Hi everyone, welcome to today's episode of Your Free Consult. A lot of you DM me like, oh my goodness, are those the fibroids you removed from that uterus? And yes, they are, and that's the reason today we're going to talk about uterine fibroids, so stay tuned. So I hope a lot of you saw my post recently on how I was recently diagnosed with a uterine fibroid. Okay, it was a really small one. It's not causing too many problems, but it really shook me, and that's the reason why I felt I must tell you guys more about uterine fibroids. I'm sure some of you are thinking, what exactly is a uterine fibroid? So basically what it is that it's a smooth muscle benign tumor, and what that means is that it's a tumor that's made of smooth muscle, but it's not cancerous, and we're not really sure where they come from, but there's a number of risk factors that women can have in order to be able to develop uterine fibroids. And the saddest thing about it is that the first risk factor is just being black. So black women tend to get uterine fibroids way more than Caucasian and Asian women, and so just being black is a risk factor for developing uterine fibroids. Another risk factor is what we call nulliparity, which is basically if you've never had children before, that's a risk factor for developing uterine fibroids. I don't know if it's like your uterus feels unused and so it develops fibroids. I'm not really sure, but the fact that you've never had a pregnancy before is a risk factor for uterine fibroids. Obesity is another risk factor. It's a risk factor for very many things, but yes, it is a risk factor for uterine fibroids as well. And the last factor I'm going to tell you about is high estrogen states. This is when the body is producing excess amounts of estrogen, or when you're taking in estrogen from an external source. So any high state of estrogen will give you uterine fibroids. And if you already have uterine fibroids and you put yourself in a high estrogen state, there is a way that the fibroids may grow, which is another reason why fibroids tend to grow during pregnancy, because pregnancy is a high estrogen state. So what are the different types of fibroids? So we usually classify fibroids mainly in terms of their location in the uterus. So the first is what we call subserosal fibroids, and these are fibroids that are on the very outer surface of the uterus. And these are not really harmful in terms of giving you very many symptoms, which I'm going to discuss in a very short bit. But when your fibroids are on the outer surface of the uterus, they're called subserosal. When they're in the muscle layer of the uterus, or in between the muscle layers of the uterus, they are called intramural, and the majority of women have intramural fibroids. They make the uterus really bulky. They can cause a lot of pain. But I think the worst kind of fibroid is what we call a submucosal fibroid. These are fibroids that are in the very cavity of the uterus. These cause lots of bleeding, they make your period quite heavy and irregular, and they can cause infertility because they occupy the space where the baby is actually supposed to implant. And so there are three types of fibroids. We also have something called a cervical fibroid, which is where a fibroid can grow on your cervix. It's a little bit unusual, but yes, it can happen, and those are the different types of fibroids. So what are some of the symptoms that you can get when you have uterine fibroids? The first and most common symptom is heavy menstrual bleeding. So women who have uterine fibroids tend to bleed very heavily. At the same time, you can have a very painful period, which we call dysmenorrhea. So a period can be heavy, it can be painful, and it can also be irregular. You may find your period either takes very long or takes a short time, or you can't quite catch the regularity of your period. So those are three menstrual abnormalities: pain, heaviness, and irregularity that you can get with uterine fibroids. One of the other things that you can also get, unfortunately, is infertility. So remember I mentioned that you can have a fibroid at the very cavity of your uterus, and this can make the baby not implant during conception, and so that can cause infertility. You can also have a fibroid block one of your fallopian tubes, which can make the conception difficult as well. So infertility is actually a symptom of uterine fibroids. Another symptom is anemia. So when you have very heavy menstrual bleeding, you can tend to lose lots of blood, and that can make you anemic, and especially if it goes on for a very long time. So I tell a lot of my patients before surgery that we have to correct the anemia, because the surgery involves quite a bit of bleeding as well. And so this is how anemia causes a symptom when you have uterine fibroids. One of the other symptoms is dyspareunia, which is painful sexual intercourse. If your uterus is very bulky, very low, it could cause quite a bit of pain during sexual intercourse. It can actually also cause abdominal distension, and I don't know if you've seen women who have such severe abdominal distension that they actually look like they're pregnant, which is really ironical because sometimes they're struggling to get pregnant because they have uterine fibroids. So it can make the abdomen quite distended. One of the other things that fibroids can cause is recurrent pregnancy loss, especially when a pregnancy partially implants in the uterus, and then because of the fibroid you get a miscarriage. And this can happen over and over and over again because of fibroids, and so we call this recurrent pregnancy loss, which in itself is actually a symptom of uterine fibroids. It may be a symptom of other things, but it is a symptom of uterine fibroids as well. And last but not least, pressure symptoms, and this is probably the worst symptom of uterine fibroids. Pressure symptoms is when uterine fibroids make the uterus so bulky that the uterus starts to lie and affect other organs. So it can lie on a particular organ and affect it. For example, if the uterus lies on the urinary bladder, it can make you have chronic urinary tract infections, difficulty in passing urine. If the uterus becomes really heavy and starts to lie on the rectum, you can have constipation and difficulties in passing stool. Worse off, if the uterus starts to lie on the ureters, which is basically the tube that conducts urine between the kidney and the bladder, you can end up having acute kidney injury or other kidney injury and even kidney failure. But I think probably the worst symptom is when the uterus gets so heavy and starts to lie on the lower limb vessels. So these are the blood vessels that conduct blood from the abdomen to the lower limbs, and what happens in this case is that you get a blood clot in your lower limbs. And the worst part is that if this blood clot dislodges, it could either go to your heart, lungs or brain, and that could actually be fatal. So I hope you've understood what exactly a fibroid is. I hope you've understood some of the symptoms, where they can occur, what can happen. And so what we're going to do is next time we're going to discuss the complications. We're going to discuss some of the tests that your OBGYN is going to send you for. We're going to discuss some of the treatments, both medical and surgical options for treating uterine fibroids, because both of them do exist. And I'm going to tell you more about what to expect after having uterine fibroid surgery, which we call myomectomy. I hope this session was informative. Please don't forget to join me for part 2 of this session, and see you next week.